This episode is sponsored by Mom Juice. If you're new around here, let me fill you in. 4 years ago, my amazing business partner, Kristen Taylor, and I co-founded Mom Juice. We're all about keeping the bullshit out of wine, literally. And I'm not kidding when I tell you, when we started this journey 5 years ago, we were one of 6 wineries to even put the ingredients on the back of our labels. Not only are we vegetarian, we're gluten-free and low sugar. But here's the fun part. As your OnlyMoms sponsor, we're hooking you up with 20% off your next order. Head over to momjuicewine.com and use promo code OnlyMoms because, girlie, you deserve it. I need everyone to listen up, and this is going to sound crazy if you've never actually talked to a pelvic floor specialist, but the answer of Kegels can solve everything actually could be harmful. It should not hurt to orgasm. Like, it should not be painful to work yourself up to that point. That's not normal.
Not normal to be painful, and also not normal to not know how to achieve one either, because we work with a ton of women and moms that maybe have never orgasmed before. And I'm like, girlfriend, that breaks my heart for you.
Never, even before baby? Mm-hmm.
Most women are candidates for VBAC. And so there is this, again, this like old narrative of like, oh, it's totally normal to pee your pants. Like, oh, once a C-section, always a C-section. Things were coming out of all different ends.
Welcome back to OnlyMoms, my people. Today, I'm honored to have Dr. Jessica London on. She is a doctor of physical therapy, pelvic floor specialist, and a mama of 2 on the pod. I just learned her kids are 3 and 6, so we have so much to dive in on there. But Jessica specializes in pregnancy, postpartum recovery, and return to impact fitness. Her passion stems from her own experience of becoming a mom, which we will dive into later. And her mobile practice meets moms where they are, literally and figuratively. Geez Louise. Welcome, Jessica. We're so excited to have you.
Thanks so much for having me, Macie. I really appreciate it. I'm excited to chat.
I feel like we need to start with an icebreaker, and it's crazy because we all, as moms, have something in common here, but we don't talk about it enough. So like peeing your pants postpartum is not normal.
That is not normal. That is literally called pelvic floor dysfunction. It is a sign that your body is screaming for help and really does need to get some quality specialized care.
Not screaming for help, girl.
Screaming for help.
Screaming. Oh my God, that's crazy. Okay, so I think it's safe to say that we are the first generation for a lot of women's health studies and care. Everything from perimenopause, hormone studies, endometriosis, and your specialty, pelvic care.
Yeah. I think that's probably why we have such a, old narrative of like, oh, that's just normal after you had a baby, and why maybe our moms and our grandmas, of course, just lived with it. I know like my mom's generation, this was so normalized for them, and peeing their pants and buying panty liners after they had their children is just like quote unquote normal, that they have done it for so long that they don't know anything different. I'm like, girl, we could literally solve that in 3 to 6 months. We could get you to stop peeing your pants. It really doesn't take that long.
I need you to repeat that, because there are women that will go decades. Yeah. You hear it like, okay, once you have a baby, you'll never jump on a trampoline. You'll never jump rope, right? They go decades leaking. And this is like not just like, it can be front or back leakage, right?
Yeah, totally.
So, okay, 3 to 6 months is how quickly you can start to see improvements.
Yeah, absolutely. I think that there's like this misconception that it's going to take so much time, or if I've already been leaking for years and years, that like I'm too far gone, or I've already tried the Kegels, I've tried the YouTube exercises and it's not working. And that is just unfortunate, because like each person needs individualized support and care. And like, just to kind of like back up, we do this online with people. We actually are 100% online. So 3 to 6 months of people being able to target not only their mind-body connection, but also build strength is really what allows us to be able to reverse that in 3 to 6 months.
Okay, Jessica, I have a lot of listeners who are pre-moms, right? They're getting their bodies ready. They're thinking about it. They're about to transition into that phase of even trying, right? So catch everyone up. What is your pelvic floor before we get too deep?
Yeah, this is so important too, because even pelvic floor dysfunction is not limited only to moms. People can start experiencing pelvic floor dysfunction as early as teenage years, right? So these are things that could have been with you for a long time, and then becoming a mom just exacerbated it. And I think that's kind of important for people to know and not feel as alone in that. But to kind of back up, right, the pelvic floor is a group of muscles. It sits at the bottom of your pelvis. So if you're sitting and driving and listening in, like if you kind of rock side to side, there's those two sit bones. You feel that?
Yep, got
Those
it.
two bones. Okay. Now, the pelvic floor is in between those two bones. But then also, if you reach around and find the tip of your tailbone, and then you reach around to the front and find your pubic bone, the front of your pelvis, the pelvic floor literally spans between those 4 points. So it
Pelvic floor officially located.
Okay,
Got it.
amazing, perfect. So that whole area, the pelvic floor sits sort of like a hammock, and it's very buoyant, right? It actually is sort of mimics like a trampoline, and it holds up our pelvic organs, our bladder, our uterus, our rectum are literally connected and pierced through the pelvic floor muscles so that we can pee and poop and have intimacy and all of those things as well. But it also serves a lot of other functions, right? It allows us to not pee when we don't want to pee and only pee when our brain and our bladder are connected to that. It serves as more of a sump pump function and circulates blood and lymphatic flow. It's also the floor and the foundation. If you think about it like the foundation of your house, the pelvic
Mm.
floor is literally the foundation to the core system, to the entire body. And so oftentimes the pelvic floor is interacting well with the hips and the glutes and the core system and the thoracic spine and the rib cage. And so it really isn't something to be looked at isolated, but it is a group of muscles, just like any other muscle in the body. It does respond to training and rehabilitation, just like any other muscle in the body.
Again, before we get into deep on like all the mom stuff, right? Like our pre moms out here, you may already have bladder or pelvic floor issues, things going on. Jessica, what do you recommend for those girlies that are like, holy cow, like I leak and or I constantly have to go and I haven't even had a baby? What are some things that they can do to prepare themselves for one, pregnancy, holding everything in, and then two, like the postpartum journey?
Yeah, get help now, right? So the best time to get support is the time that you're noticing, I'm experiencing leakage with coughing, sneezing, exercising. I feel like I have to go pee and I have to rush to the bathroom. I have no bladder control. I can't hold it. I have that urge and I have to go. Maybe they have pain with intimacy, pain or inability to orgasm or painful orgasms or just
Mm-hmm.
pelvic pressure. These can all be signs and symptoms that you really need some more customized one-on-one support. So I recommend really working with a specialist. A pelvic floor specialist can either be an OT or a PT to make sure that you're with the right person.
What is the difference between OT and PT?
Okay, PT stands for physical therapist and
Okay,
OT stands for occupational therapist.
got it.
Both of these professions can specialize in pelvic health, right? So the
Got it.
PT lens can come more from like an exercise rehab side of things, but that
Mhm.
doesn't mean that OT can't. OT does a really good job of also really including like social events, mental and
Mhm.
emotional health, which really intertwines into pelvic health as well. So, in our team, we have myself, who's a doctor of physical therapy, and we have another board certified physical therapist, but we also have an occupational therapist as well that went on to specialize in pelvic health that also really specializes in stress and mental and emotional health that comes kind of conjoining with pelvic health symptoms because it is absolutely tied in the literature and the research. If you have pelvic floor dysfunction, there's an increased risk in anxiety, depression, social isolation, and all of those things that people really don't talk about.
And we'll get to that later, like the connectivity of all the neighboring things, because I think that's really important to talk about. But what does a pelvic floor exam actually look like?
Yeah, so if you were to go in person, you have the option to get a pelvic floor exam. So if you're with a good provider, they'll get your consent and they'll do what's called an internal pelvic floor exam, where they will go in through the vaginal canal. They can also do a rectal canal as well. So that is an option if you're experiencing more like tailbone pain or anything like that, more towards the back part of the pelvic floor. But if they go through the vaginal canal, then they're able to reach the pelvic floor muscles directly.
Mm.
So this allows them to get to those deeper levels of the pelvic floor that connect into the hip or to the tailbone. And they can do an internal exam that not only tests the tone and the contraction and the coordination of the muscles, but also just your tolerance to being able to be connected to that region as well. It is one of those things that can absolutely be helpful for some people, but other people, it will really prevent them from getting the support that they need. So I also just want to say, like, doing an internal exam does not determine the results that you will get. It is an option. It is like an added, extra, if you will. But I know some pelvic floor therapists that work in person with clients and don't do internal exams at all, or they just leave it as optional up to their clients.
Got it. That was really my next question, is if it was absolutely necessary, especially because I know you have a mobile practice, right? And you guys have a 4-step program, correct?
Yeah, so we work with clients 100% virtually online. And it's more of like in a coaching wellness aspect where we're not only doing pelvic floor rehab, but we're also doing the return to strength training, nutrition, stress management, all of those things that moms need, right?
Mm-hmm.
And we do have a 4-phase like pelvic floor restore method that we take our clients through. Obviously, being virtual, we don't do any internal exams, and we still get pretty incredible results in 3 to 6 months, reversing pain, reducing, leakage, and able to get moms back to hiking and running closer towards that 6-month mark.
Yeah. So it's interesting because I am a runner. I started my pregnancy journey with a pelvic floor doctor who I absolutely love. Because I went in person, right? She did, after I gave birth, give me an actual exam. But I think that if I went to my regular OBGYN and they were not referring me out, and I asked them when they were in there just like examining things to give me an exam, and this is not a dig on OBGYNs, but they're not specialists in the pelvic floor, right? Like they're not doing that extended study. And I think that even going through your program, if you needed to go deeper and go to someone more local and get a physical exam, understanding the verbiage and the advocacy for yourself is very important, because like there's so much that can happen.
Yeah, absolutely. It's always important to listen to your body and tune into your intuition. And every certain single mom's body or woman's body, they're going to need different things. So that's why like that individualization is so important, like you mentioned. And from somebody who's like an expert and not just pelvic floor lens, like your OB is an expert in delivering babies safely, but they're also a trained surgeon, right? Your midwife is an expert in delivering babies, but they're not a trained surgeon. So they're looking at things from a more conservative lens without as many interventions. A pelvic floor therapist is like really focused on rehab and recovering from pelvic floor dysfunction. So our lens that we look at things is very different than OB and midwives and doulas and all of those things.
Okay. I need everyone to listen up. And this is going to sound crazy if you've never actually talked to a pelvic floor specialist, but the answer of Kegels can solve everything actually could be harmful.
Yes.
Right?
Yes.
Okay. Let's talk Kegels.
Let's talk about Kegels, because this is a very outdated advice and term that a lot of people are resulting to. I've been doing my Kegels, maybe I'm not doing them enough. And that's the reason why they're still having pain or leakage or heaviness. The way that I look at this is like Kegels are like the 10% of the masterpiece puzzle. It is like the corners, right? It is an outline. It is a way for us to be able to understand, do you even know where your pelvic floor is at? Could you contract it? Could you relax it? To me, it's like the foundation from a mind-body perspective, but it is not the solution to solving leakage, pain, and heaviness. Majority of the times we're needing to recruit other parts of the body or look at other parts of the body above the pelvis and below the pelvis to make sure that we're actually solving dysfunction at the source, because Kegels alone are not going to be solving dysfunction typically.
I like to compare the pelvic floor experience with your experience with a massage therapist, right? So there's so much connectivity. If you go to a massage therapist and you have a sore back, right? it makes so much sense when they say, yeah, you have a sore back because your hip and your body is doing all these other things to make up for your hip. I'm going to massage your hip and then your back is going to feel better. And the connectivity of your body and how the things are all relating. What are some of the neighboring side effects if you have a weak pelvic floor that could be happening to you that you're like, it's literally not screaming pelvic floor. It's like lower back pain.
Yeah, it could be lower back pain. It could be like really chronic deep hip pain or groin
Mm,
pain. A lot of times, like people that have hip pain, that's kind of unrelenting, or they're like, I just can't get to it. Like, I just can't figure, I can't stretch it out. I can't mobilize it. I can't massage it enough. I can't even strength train it enough. Typically, those are pretty clear pelvic floor issues versus hip issues. They're just like creating hip issues for you.
mhm.
So yeah, I think hips and back and even thoracic and rib cage too, right? Because it's all connected. We talk about the pelvic floor being the floor of the core system, and the core system is, part of the diaphragm and the transverse abdominis. And so even all the way up to your rib cage down to your pelvic floor, those all work together or should be working together.
Right.
Yeah.
So when we talk about this, right, like again, you wouldn't go to your massage therapist and tell them I carry all of my stress in my shoulders, and then they do the same massage they're giving to everyone else and they're working only your legs, right? Like this needs to be a customizable recovery for every single person. We all get something different, very individualized. What are some of the other industries that could affect it? Like when I think of that, I immediately think, okay, does my fitness trainer, for example, have the education on pelvic floor where, like, am I doing the right exercises? Like, where are some areas that we could also be missing the mark on pelvic floor health just day to day?
Yeah, I mean, I just think you're totally right. Like in general, there's such a lack of education on the pelvic floor. So, yeah, if you're definitely working with a personal trainer or a fitness trainer by any means, like those are great questions to ask them. What's your training on pelvic floor knowledge? What's your training on prenatal knowledge? What's your training on postpartum recovery to strength training? A lot of times, like fitness trainers will go straight into strength training with forgetting the pelvic floor and core rehab side of things. And so it's important that you ask those questions. I also, I speak to fitness training conferences too, to try to help educate them on how do they ask the appropriate questions for their clients. So if you're like a fitness trainer, you're like maybe a neighboring niche of ours, one way you can really support your clients is just by asking them, like, the questionnaires of like, do you pee your pants? Do you feel like you have to rush to go to the bathroom? Like, are you dealing with pelvic heaviness? Just a
Mm,
quick screening can be so helpful and also make women feel so heard and validated because
hmm.
their trainer or their OB or their midwife are asking those questions. That's sometimes all we need, is just for all the disciplines to just start screening for pelvic floor dysfunction.
It's crazy because I feel like in the mom community, we joke around like, yeah, I pee my pants. Yeah, I do that. And it's almost like a sarcastic way to mask the embarrassment of the fact that no one is asking us how to stop peeing our pants. No one is helping us figure out the solution of like, this isn't normal. Right. And so, especially like, I love that you educate the fitness trainers because they may feel also uncomfortable asking the questions until they realize how necessary it is.
Yeah.
Okay, so again, I know everyone is different, but if you could please give me a time frame for returning to the gym postpartum. Like what's the magic number?
Yeah. Okay. I love this. And there is no magic number. So I can't give you a magic number because you're right. It is going to be different for everybody, but I'd love to give a range. And that range might give you a little bit more confidence in knowing what's appropriate and what's not appropriate. I personally feel in the clients that we work with, focusing from 0 to 12 weeks specifically on pelvic floor and core rehab, right? And
Okay.
so when we're thinking about returning to the gym, this can happen really at any timeline, but there still should be some level of like a foundation that is rebuilt before we just start hitting squats and deadlifts and lunges. Because even if you're 9 months postpartum, which is totally
Mm,
a safe, appropriate time to start going back to the gym and start loading up and doing deadlifts, if we never took, 6 to 12 weeks to just only focus on pelvic floor and core rebuilds from the inside out, then what might happen for that mom at 9 months postpartum is then she might start having back pain or leakage or pelvic heaviness. So
Got
in
it.
my opinion, it's really more about like the order of operations versus the timeline, because we have absolutely helped moms get back into the weight training gym or, run 5Ks at 3 months and 4 months and 5 months and 6 months postpartum. But again, so much goes into that. What was their pre-pregnancy fitness level? What is
Mhm.
their sleep like? How is their baby transitioning? What is their stress management? What does their support look like? Do they have the ability to do that pelvic floor and core work starting a week postpartum and just gently building it up week by week over time, so that when we get to that 3 month mark or 4, 5, 6 month mark, they're actually strong enough to be able to run the 5K or get back to the gym without risking or without having a lot of those symptoms. That's the goal.
Got it. Okay. So, what's one movement or like habit you recommend avoiding the first 4 months? Because in my mind, like as a runner, I still lift weights as well. But for me, it was like, oh my God, no pavement running.
Yeah. Yeah. And I think that, that's tricky, right? Because I like to kind of think in the gray area where there's not like good exercises and bad
Mhm.
exercises, but there are the right exercises at the right time in the right order. So it is
Okay.
important to make sure that we're building strength. If we think about running, right? No pavement running is like one big blanket statement, but what about it's a single leg sport. So did we build up single leg strength before we
Mm,
got you to, doing a whole, 1 mile
yeah.
run? Did we build up single leg strength in one position, and build up that glute strength and the hamstring strength and the quad strength your body needs to be able to support the pelvic floor before we get you running a half mile or a mile?
Mhm.
Did we do more of a walk to run program where we could have you walk for a half mile and then run for a half mile and walk for a half
Right.
mile? Like, is there some sort of like slow progression that we can get you back to there? So I know I'm going to be like the person that says like there's no all or nothing mindset. There is no like this is bad for everybody. It
Hmm.
really is so individualized, as you said. But the most important thing that I'm sure that brings like a lot of moms peace is like, hey, look, your timeline is your timeline. Let's just do the order of operations in the safe and appropriate way where we're not 4 weeks postpartum and just going back to deadlift with the bar.
Hmm.
Let's just like rebuild first and then let's get you back to
Yeah.
deadlift with the bar.
I think the amount of grace during this period that you should allow yourself and like the ability to go back to your doctor and say, well, I tried it and I wasn't ready. Like that mind body connectivity is so big. I remember when I went in for an examination and my pelvic floor doctor was like, okay, your pelvic floor is telling me you're ready, but like, I need you to not go out here and run just off the walls. We need to
Mhm.
do a walk run. I need you to stop and evaluate your body. Like, how does it feel? And when I tell you, I ran that first little bit and I actually thought things were going to fall out of my pants, like body
Yeah.
parts. It hurt so much. I text her and I'm like, it didn't go as planned. The pelvic floor is not ready, right? Like,
What a great test though, right?
yeah, it was crazy to me because I'm like, how is this still so painful? You know?
Yeah. Well, and just the amount of force. Think about like depending. That's one of the things that we really love specializing in is return to sport, return to high impact fitness.
Hmm.
Because doing like bridges on your back or single leg raises and dead bugs, like those are very basic exercises. We
Hmm.
can't expect to go from that type of exercise to high impact velocity running and jumping, where there's a lot more force, a lot more transfer of pressure going down to that pelvic floor. So it
Yeah.
really is like you said, like it is that small test that we can do. We have like a return to run readiness assessment that we do too of, okay,
Okay.
can she hop on her leg for 10 times single leg? Can she then do like forward bounds 10 times, right? So
Mm.
it's all about those tiny little progressions that we can
Okay.
make to get you to the event of running is we're working towards running, but we're breaking running down into like a 12-step process to get you back there
Right.
safely.
Okay. So that was my next question is how do you know the pelvic floor is ready for high impact exercise or activity? Like, and it is a mix of all these small things.
You're absolutely right. Right. We have like a return to impact fitness assessment. We have a return to run assessment, and it is breaking down whatever that sport is. So if you want to get back into CrossFit or if you want to get back into running, it's saying, okay, what does that sport or that high fitness, sport, if you will, do. Let's break it
Mhm.
down and figure out what most muscle groups need to be strong. What coordination does she need? How much balance does she need? And so breaking all of those pieces down into a more manageable bite-sized piece where we're building that up so that when we get you back to doing that event, whether it's volleyball or pickleball or
Mhm.
tennis or all of the things, we know what type of activities you need to be able to train, breaking down even to the point where we just worked with a pro tennis athlete and getting her back into being a coach and training for herself. There's a lot of cross body stuff going on there. So, what are we doing in her training program to mimic return to sport for her
Mm.
specifically?
It can't be easy, ladies.
I know
Like,
we always want the magic bullet,
I
and
know,
that's why Kegels don't work, right? Like,
right?
or we do the Kegels and then it creates more pain, and like we weren't a candidate for Kegels anyways.
Ugh. Okay, so raise your hand if you feel disconnected from your body.
Not me anymore,
Yeah,
but I'm giving you moral support.
thank you. I think this is so mind body connection is such an interesting conversation because we're moving at 100 miles per hour. Like I just said, we always want the easy answer, the easy out. Like I'm willing to do the work, but I would love for it to be like a fast, efficient process. How much does mindset matter in postpartum pelvic recovery?
Oh my God, it's everything. Just like mindset and motherhood and mindset. And
Everything. Got it.
it's
Okay.
literally everything.
Noted.
Like I tell people, even when they inquire to work with us on inquiry calls, is like, do you believe that you can heal? Right. Especially for these
Mm,
mamas that have been dealing with leakage or pain for like 3+ years, that they're in this mindset of like, I'm not solvable. Like, this is just it for me. Like, I don't believe healing is possible for me. And it's just like, if you don't believe healing is possible for you, or you don't believe that you're going to get better, then you're not.
mhm.
Right. So it is really important to also be that, be open minded and be willing to bend and to adapt and to accept new philosophies and new teachings and all of those things too.
I also feel like it's one thing to say like I know that I can heal, but are you going to give yourself the time to do it, right? And not saying like, "Oh my gosh, I scheduled an hour to meet with Jessica virtually." Are you going to prioritize yourself in a way to actively change things that you're doing every day or like pour into yourself every day to heal?
That's such a great point because consistency is everything. Right.
Mhm.
So it's like, yeah, we have to, and we're like not perfectionists over here. And like, no moms are going to be perfect. Like, we literally work with busy moms. But my thing is like, can you be 80% consistent? Because if we
Mhm.
can be 80% consistent on a week by week basis, like you will see change. But just to your point as well, like, we need consistency in order to build the nervous system tolerance, in order to build the mind body connection, in order to literally build tissue hypertrophy and to build strength. We need to
Mhm.
repeatedly be consistent and load the body and, stress the body in that way so that it can become more resilient for us.
Mm. Dr. Jessica, I needed that message today. Okay. I needed to hear that 80% giving into myself is enough for the moms that are like overachiever, 150% or bust type girlies. Like 80% is acceptable. And it doesn't mean to give up midweek because you're like only this much there. Thank you. That was great. What pressures or habits or activities do most people miss in their everyday life when it comes to mind body connection?
Yeah, I think, mind body connection starts even just with our breath, right? Like, can we take the moment to pause? Especially as busy
Mhm.
moms, especially if you're a type A mom or, an overachiever mom, like, can we take 5-10 minutes to just pause our body and to breathe? And when
Mhm.
we can do that, we then get regulated and we can connect to our body. And so we start all of our moms there, especially if they're, in pregnancy or postpartum or even beyond, it doesn't really matter. Can you take 5 minutes to just start with the breath and to ground yourself and to center yourself and to get that mind body connection on board for you again? That's really crucial to like everything that we do on top of that, right? So we call this habit stacking, is
Mm.
what small habit can we start on like a daily or at least 4 days a week basis where we're at least 80% consistent, and we'll just stack those habits over time. And then before you know it, you have 5 or 6 habits stacked and you're getting the results that you want. You're seeing the body transformation and changes that you want because you were willing to like stick with those small habits over time.
And for all of the speed demons like me, she said 5 minutes and not 5 breaths. So we need to set a timer.
Yeah.
Okay. I'm
Give this your
telling
kid
you,
fiber.
I'd be like, great, 5 breaths. I can do that in 1 minute and 30 seconds. Let's go.
Yeah,
Right.
and then you'll be hyperventilating.
So you mentioned that pelvic health impacts mental wellness and intimacy.
Oh, yeah.
How do you integrate this mind body approach into like the conversation of intimacy?
Yeah, I think that, the interesting thing about mind body connection is we think about the nervous system safety, our regulation within that.
Mm-hmm.
Now, throw that with intimacy. Intimacy itself, and it can have a lot of like shame, and there can be a lot of secrets and taboo and TMI, and there can be a lot of topics that we never explored with ourselves. So, a lot of times, what we see kind of the connection between pelvic floor and pain with intimacy, of course, there can absolutely be like physical restrictions and tightness and tension, but
Mm-hmm.
a lot of it also is like, how safe do we feel in our own body? Like,
Mm-hmm.
how at ease do we feel in our own body? And how comfortable are we having those conversations with ourselves? Do we know what our desires and interests are? And then how comfortable and confident do we feel communicating those with a partner? All of that goes into that mind body, like nervous system component, integrated into pelvic floor as well.
Got it. Ladies, again, it should not hurt to orgasm. Like it should not be painful to work yourself up to that point. That's not normal.
Not normal to be painful, and also not normal to not know how to achieve one either, because we work with a ton of women and moms that maybe have never orgasmed before. And I'm like, girlfriend, that breaks my heart for you. And
Never even
so
before baby?
no, they just like have never been able
Oh,
to, because of like tension that might be present or shame or a lot of other things that could possibly be
okay.
going on. So
Wait,
maybe
wait,
they,
wait. So where do
yeah,
you start with someone who has never experienced an orgasm?
first of
You
all, I
still
want
not
to
here?
know of it's a little bit of both. It could
Okay.
be a little bit of both, right? They could be so tight and tense in their pelvic floor and holding so
Mm,
much tension that the pelvic floor doesn't have the ability to release and lengthen. So, kind of just technically speaking, one of the functions of the pelvic floor is sexual. And in order for the pelvic floor to work optimally, the pelvic floor needs to be able to relax and open for penetration and to deliver babies, right?
mhm.
And also, it rhythmically contracts when we are experiencing an orgasm. And so, if the pelvic floor is living in this chronic tense state, it doesn't have the room, the bandwidth to be able to reach that climax rhythmic contraction. So, they might not ever be able to achieve that, or they feel like they get close, but they're not able to find that release. That could
Right.
truly be a physical pelvic floor issue at play.
So for that girly who is so clenched up, the Kegel is like a no.
Please stop doing Kegels. Right. Like, please stop.
Right.
Pelvic pain, tailbone pain, deep hip pain, pain with intimacy. These are all signs and symptoms to lay off the Kegels.
Got it. Okay.
Mhm.
What are your thoughts on the yoni egg?
Yeah, good question. Look at you going there. I love that. So, this is another one of those like very controversial things. In
Yeah.
our practice, we don't believe in shoving anything up there to make it even stronger or tighter or
Oh,
tenser. Because one thing that is true about the pelvic floor is it does not work in isolation. And
mhm.
anytime we're doing Kegels, we're trying to work the pelvic floor in isolation. You stick a yoni egg up there, you're trying to work the pelvic floor in isolation. They're the shorts that vibrate and contract. It's trying to work the pelvic floor in isolation. But the thing is the Kegels and the pelvic floor do not work in isolation. They co-contract with your deep core system. They work with the rib
Mm,
cage. They work with the mobility in the hips and the glute strength. So the the pelvic floor doesn't work in isolation, so we can't train it in isolation. I will say one thing about vibration though, because I
okay.
do think it can be helpful to increase blood flow to the
Mm,
pelvic floor. So vibration is different than sticking a device up there or a Kegel weight or like a
okay.
yoni egg and focusing on contracting by adding a pound, right?
Mm,
This is a little bit different. So, oftentimes, vibration can help relax the pelvic floor, stimulate the pelvic floor and the nervous system to create some safety. And it can also
okay.
help the pelvic floor rhythmically contract, which does increase blood flow to the area for repair, for healing, for health of the pelvic floor, too.
So you're saying vibration outside or like you're penetrating and vibrating?
Both. It could be both.
Okay.
Yeah.
So in any of the ways.
Any sort of vibration.
Okay. Interesting. So then, okay, let me ask you this, because then when I was pregnant, I got one of the wands, right? And it's like, isn't this just a fancy sex toy, right? Like whatever. But of course they're like, oh no, it's pelvic floor, right? Like, so do you think that that vibration could be helpful, but it's not absolutely necessary to strengthening the pelvic floor in preparation for birth?
It's absolutely not necessary, but vibration can be helpful to reduce pain, to try to release tension, especially if you're more prone to pelvic floor tension. The
Mm,
wand that you're talking about can be a tool that you can have and use at home that can do some sort of internal releases. And sometimes they have like warming techniques or vibration ones as well. There's like combo wands, if you will. So it absolutely can help the pelvic floor learn to like release and lengthen and just kind of find that safety and release that it needs. The
right.
vibration can help with that, but it's not absolutely necessary to be able to achieve a quote unquote strong pelvic floor.
Got it. Are there any pelvic floor exercises or intimacy exercises that you recommend for couples?
There's quite a few different ones. I would look into Coco New. They're one of my
Mm,
favorites. Coco
okay.
New is a coconut lubricant. They also do
Mm,
toys, and they also have water-based lubes and oil-based lubes that are like
okay.
synthetic free and don't have any of the crummy ingredients. And then Woo also is a great brand, and they have intimacy toys as well. I think when it comes to like sex toys and all of that, it really depends on the couple's preference and desires too,
Hmm.
and just also like permission to explore. I think it's important for women to know that, like, hey, you're allowed to know what you like and don't like. You're allowed to explore with your partner. So get a few of them and figure out
Yeah.
what you like and don't like.
I also think giving yourself permission to re-explore just intimacy in general after baby is like an area that's not talked about enough. I almost feel like sex after baby was a more complex thing than the first time ever,
Yeah. Why do
right?
you think
Like,
that?
what was that?
Why do you think that?
I think it was less about my partner and more about how I felt in my own skin as had just given birth and not looking, like first time mom, like I had never seen my body in this way. I also like, was I all the way healed? Like, you're wanting to push the boundaries, but like not too much. And then it's like, oh my God, how do I even look right now? And there's so much mentally that's happening that like I definitely felt like my mind was in a different space and more of a like not insecure, but like the boundary of like concerned and insecure at the same time. Like concerned for my health, concerned for how I look, like knowing it could like cross over like, holy cow, if I saw myself in a mirror right now, I would not be into it,
Yeah.
Like, and so
Mhm.
I think that the exploration process for me, or like the need for me to give myself grace and like just breathe through it and like accept myself was a lot harder post baby
Yeah.
than it was for me ever the first time.
Yeah. And I really think that that's so normal. And I think that you just like sharing that openly, I think is so powerful and courageous too, because so many moms listening will also really resonate with that. I
Yeah.
also felt the same exact way, even knowing everything I know about the pelvic floor and rehab. I still also, it's like this vulnerable thing of like, I'm also sleep
Yes.
deprived and I'm tired and my
So
hormones are all
tired.
over the place. And I'm not even thinking about that right now, but I am kind of, and I'm curious. And there's so
Mhm.
many body changes, not only just in your whole body as well, but changes down there too, with especially with vaginal births, right? And I had a
Mhm.
C-section and I had a vaginal birth, and it was different down there for each of those
Yes.
births. And so it definitely is a thing where we have to like rebuild that self-confidence and
Mhm.
secureness within ourselves.
It also too was like the weirdness of even when you have like the best partner, most supportive partner ever of like, like when you lose your virginity, like you go into it and you're like, what if I'm in the act and I realize I'm not ready? And it's like the same thing postpartum. Like, what if I get into this and my body just like is not healed? It's not ready. Like it hurts. Like anything could happen. And it's not like a shameful feeling, but it's definitely like, oh, I'm going to have to like pause, right? And I think that that is a little bit of pressure.
Yeah, it totally is. And I call this like free intimacy, like a routine. You
Yeah.
can literally create one for yourself. And we actually do with some of our clients that are also very concerned about like, hey, last time after I had a baby, I was in so much pain. And I was like, it took until 6 months. And they like actually work with us because they want to help that process be a little bit smoother as well. So there's
Mm,
also so many things that our moms can do, like whether it's by yourself and just doing a self exam and doing self internal releases with your thumb or with a wand, just to like allow yourself to explore a little bit and get connected to that region
wait a minute.
before you
Pause,
just go
pause.
all the way.
What are these internal releases?
Yeah. So I really like, yeah, first of all, like make sure you're not bleeding while you're doing this. We don't want to risk like, infection or anything like this. So
Hmm.
you're well beyond the time that you are done bleeding. You got your quote unquote checkup, you're all cleared, quote
Right.
unquote, right? Okay. So you're beyond that phase and you're like, I think I might be ready for intimacy, but I don't really know yet. And I don't want to just like go all the way and then get to that moment like you talked about of like abort mission, we got to get out of
Yeah.
here. And that's even harder and more awkward, right? So what we can do and what we instruct our moms to do is like, don't include your partner at first. Like, why don't you utilize
Mm,
your thumb and a little bit of lubricant and, insert it at the edge of the canal, of the vaginal canal, and kind of do like a sweeping motion, almost like you're going to do a U at the bottom part. This is also where a lot of tearing happens or episiotomies. So it's
mm.
really healing for your perineum in itself to just give it a little self massage. And so just giving it that stimulation, that gentle mobility and stretch at the perineum, it's going to allow for a smoother transition for insertion and penetration later if you already have sort of started that process in a slower way. Just like we were talking
Got
about return
it.
to impact, break the main objective down into smaller pieces and allow your body to slowly adapt over time.
Love that. So
Mhm.
much less pressure.
So much less pressure. And then you kind of know, you have a better idea yourself too of like, okay, that didn't really hurt, or I actually that felt fine. I didn't feel any burning sensation or major pain with that. So you probably have a pretty good indication if you're doing it yourself and you're doing, okay, let me stretch a little bit more. Let me see what a little bit more expansion
Yeah.
feels like, either with yourself or a wand, whatever that might be. Then you have a better indication of how your body is going to respond and your perineum is going to feel when you get to that point.
Got it. Oh, those are such great tips. I feel like that was really informative. Even for me, as someone who's already been through it, right? Like, what would I do differently the next time? You
Mhm.
know, because it can prepare you for like a better experience or less like trauma overall. This entire birthing process is traumatic, and we don't sit down and applaud ourselves. I had to get blood transfusions. I almost died. Like, I didn't even realize I
Mhm.
had a traumatic birth until like a few months ago, and my daughter's
Mm.
two,
Yeah.
right? And it's like all of this can really take off some of the pressure and not like lean into so much trauma,
Yeah.
mentally and physically. So I love that. I wish that my team had time to get you wine because you absolutely deserve a round of applause for this next topic. But for those of you who do not know Dr. Jessica London, she is an absolute boss. She not only did a VBAC with her second child, but you did it with an at home birth, which I'm like terrified regardless. And so I really want to dive into this experience and you know, let's start with just your VBAC, right? Like what took you there and what did you need to get approved and feel confident to then do this at home?
Yeah. Yeah. Great questions. I love talking about my VBAC too, because I feel like it can inspire other moms or maybe just shift
Yes.
perspective
Oh wait,
too.
anyone who doesn't know what a VBAC is, maybe you could share. Okay.
Yeah, so VBAC is a vaginal birth after a cesarean. So for my first kiddo 6 years ago, I had a very unexpected and unplanned cesarean birth. And I actually planned that as a home birth as well. So for my first birth, I was planning for a home birth. And after being 42 plus three, the state was like, you are no longer a candidate to birth at home because you're 42 plus weeks pregnant in the state that I was living in. And so my midwife was like, let's throw a Hail Mary and try to self induce through, the brewers, whatever they call it, midwifery brewers or whatever. It's like a home self induction. That led to a 3 day long labor. Things were coming out of all
Three
different ends.
days.
Oh my gosh, Macy. Like, I gave it my full go for my first birth experience, trying to do it at home as well. And I
You were
was,
in labor for
yes,
3 days?
yeah, a day and a half to almost 2 days at home. And then I transferred to the hospital because we were like, okay, we're calling it at this point. I just remember my midwife coming to the house multiple times and they're like, yep, you're not progressed yet. Yep, not progressed yet. Meanwhile, I'm like throwing up, can't keep food down. It was a whole experience. And to unpack your birth experience too, they can be very traumatic when you're not even feeling like, well, I shouldn't have experienced that as trauma. But for me,
Mhm.
it was a really unplanned and unexpected experience where I ended up transferring to the hospital. We ended up calling, like, you know what, we're just going to get this baby out of here. Like, I'm already like 43 plus 4 at this point, and let's get this baby out. Perfectly healthy little 8-pound baby. Wasn't even that
Right,
big.
isn't it the drama that it took to get him here, and he's like, "Hey."
It's just perfect for his personality now. Like, it just all makes perfect sense, actually. And so, all that being said, my first birth experience ended in a cesarean. And I was a physical therapist. I specialized in orthopedics and surgery rehab. I wasn't yet a pelvic floor therapist at that time.
Got it.
And that experience was like what actually led me into pelvic floor work, led me into supporting moms postpartum. Because in my training and experience becoming a doctor of physical therapy, we got very little to no birth rehab. There was no
Mhm.
C-section rehab protocols. There was literally nothing. So I was expecting after my C-section for like the physical therapist or occupational therapist to like round the room, just like we do in every other surgery. And no one ever came. And that's when I was like, holy freaking airball. Like,
Yeah.
what just happened? Because how does a mom have a major abdominal surgery and then get sent home? Like, don't lift your baby, don't go up the stairs, don't drive. But there was no education. There was no true like referral to rehab, even though I just had major abdominal surgery. And so that led me into the deepest recommitment of my education into birth rehab, into pelvic floor, into core rehab. And I basically rehabbed myself because there were no protocols in place at all. Right. It's just so crazy. Let's take a pause for all our C-section mamas because
You
it
said I
is
rehabbed
wild.
myself.
Ugh, wild.
Okay.
Yeah. There you
Yeah,
go.
like, that's the world we're living in right now.
Crazy, so crazy. And I think it's improving thanks to social media and like more pelvic floor therapists and birth rehab providers like getting out there and being more using their voice more. But I guess like to fast forward, a lot of people have asked me like, why the hell would you choose a home birth again if that all happened for your first birth experience? And I think it just came down to like my root belief in birth. And my like root belief in birth is like birth is so physiologically normal. It is so beautiful. And I do think that the system has over medicalized it. And I
Mhm.
also think that that's coupled with our lack of ability to sit in pain. And I mean, that
Mhm.
even goes to like discomfort and doesn't mean physical pain. It could just mean like discomfort. It could just mean scenarios change or like patience or when we're triggered, like how do we sit in that discomfort? And so those things to me, it was sort of like a life's work to see how I could really navigate the birth experience in my own body, trusting my own body in that space. And like by no means do I feel that it's the right experience for everybody. I really believe the right place and the right provider is like up to the mom, and that's so important.
Mhm.
And that epidural felt really good after being in labor for a lot of days for that first birth experience. So
Yeah.
after I got that epidural, I was like, I know exactly why moms get these. That felt amazing.
I love that because with your intentions to have an at-home birth, you had no, like, plan to get an epidural, and I love that you so confidently just gave that disclaimer about how great it felt getting the epidural after being in labor that long because, uh, so often we go into labor with a birth plan and we don't allow ourselves enough space to, like, just change it. Just do what works for you in the moment.
Mhm.
And so that was really refreshing to hear.
Yeah, yeah, and I think that that's where some of the trauma can come from, is if we're unwilling or unable to bend with the changes. Because like birth is
Mhm.
so unpredictable. Even when I did have this, beautiful VBAC at home for my second, it still did not go exactly how I thought it was. I thought I was going to be in the water. I thought I was going to have this very calm, beautiful, peaceful birth that you might see on the internet, and I was a roaring, like I was a loud birther.
You
I was
were
a
in a Hallmark
lion.
birth.
I was like, even though I was like, I'm gonna have this beautiful, serene, calm home birth experience and like birth my baby into the water, that none of that happened. I birthed my baby in the seventh position that I was pushing in on the ground next to the birthing pool. And I was lionessing this baby out. And I think it's just like that is actually what helped me have the VBAC at home was my
Mhm.
willingness to not be so attached to the outcome. Because even though I was preparing for the VBAC at home, I was still very much like, if we need to transfer to the hospital, this is the hospital I want to go to, and these are my preferences when we get to the hospital. And so I was still very open and willing if needed. And I
Yeah.
think that's actually is like the surrender of the ability to not be so attached to
Hmm.
the outcome is like literally everything in birth in general, no matter which way you decide to birth.
Yeah. I think for our listeners that the term VBAC in general is just brand new. Everyone needs to understand that it is typically very hard to get cleared for a VBAC. If you've already had a C-section, a lot of doctors prefer all of your next pregnancies to be another C-section. So for the mamas who hope to do a VBAC someday, what was the due diligence process for them to clear you, Jessica?
Yeah, great question too. And I think that it's important to note like there are going to be some moms that aren't candidates for that.
Right.
And so it's good to get multiple opinions because sometimes one provider will tell you you're not a candidate while another provider will tell you that you're a candidate. So
Mm.
for me, I interviewed multiple providers. I interviewed OBs, I interviewed midwives, and ultimately, I ended up landing on somebody that felt really confident with all of my previous history, with how my C section went. They felt really confident that I was a strong VBAC candidate. And really, the research and statistics show that most women that do have a C section with that low horizontal incision site, like that, they call it a bikini cut,
Hmm.
most women are candidates for VBAC. And so there is this, again, this like old narrative of like, oh, it's totally normal to pee your pants. Like, oh, once a C-section, always a C-section. So
Mm.
I still think that that is present in our maternal culture. I do think it's changing, but it is
Great.
good to be aware that, once a C-section doesn't always equal another C-section, you can advocate. You should ask for multiple opinions. And
Mhm.
for me, once I was able to kind of lay out my previous birth experience and what happened, I got my hospital records too. Just know you guys can do that. Like you can literally call up your hospital and ask for your medical records. And in the medical records, it will say everything that went down at the hospital. And you can
Got
like
it.
have that printed out and share it with the people that you are interviewing and talking to so that they can like physically look at what happened. And so
Okay.
that's another really good, like tangible way people can really audit if they're a candidate or not.
Why did they say you weren't a candidate with your first recommendation?
So I think it was just old belief patterns.
Got it.
Yeah. I think it was just like their comfort level of it. Like,
Mhm.
oh, well, you labored for multiple days and it might be your pelvis is too small because once you did end up get to the pushing stages, where you pushed, but your baby's head got asynclitic and it means it was tilted to the side. And so basically they deemed it as small pelvis, which is
Mhm.
very rare statistically, but it is like a belief system that certain providers have, maybe those older providers that have been practicing more in old age versus new age.
Mhm.
And also, we're challenging providers' belief systems and mindset
Yeah.
as well.
Okay. That's really good to know. What's the one thing most VBAC hopeful moms miss when preparing their bodies?
Yeah, preparing your mind, right?
Mm.
my first birth experience for home, I was like, I'm going to do the dates and I'm going to do the prenatal stretches and I'm going to go, I do all of the things. And I literally did like follow it to a T. I exercised my whole pregnancy. I ate the dates. I drank the raspberry leaf tea. Like I did all the quote unquote silly Pinterest things that they say you should do.
It's so funny because I did all of that too. And then we're also sitting here like challenge the beliefs of modern medicine.
But I think
but give me the dates.
Let me eat the dates because it's supposed to soften the cervix. And apparently it is. But I think that you can almost like over control your way into trying to create this birth experience and stress yourself out so much preparing for this quote unquote like perfect birth experience that's on paper that you have a birth plan for. And that in itself can actually like stress out your body to delay labor and to not be ready to release, because birth is such a surrender. It really is a surrender, especially doing it at home. And you have to have like a very deep trust and belief within yourself and be willing to surrender and ride those waves. And I think for me, preparing from my first to my second, it was really like all mind. I had to go back and sort of re-heal and relive the trauma that I did for my C-section and really work through like nervous system regulation.
Yeah.
And I like literally held ice cubes in my hands and was like, okay, I feel so uncomfortable in this moment. Like, how do I just like close my eyes and soften and release and like breathe into this? So it's like learning to sit with that discomfort and also just not being attached to the outcome. I think those are two big things I did for my VBAC.
And ice is also a great way for any anxious moms out there to almost shock your nervous system and tell you to stop being anxious and almost like, reconnect you with your body in that way. Dr. Jessica, from a like PT standpoint, what makes VBAC different from like a first time vaginal birth recovery?
Yeah, well, if you had a C-section for your first birth, you're dealing with some sort of scar tissue that's likely present at the lower abdomen, which could affect the pelvis and the hips and everything like that. So if you're going for a VBAC, it is important to address like you did have major abdominal surgery and there are likely layers that are adhesed or stuck. And that's not to create fear. It's just to create more advocation for yourself in your prep work. So just really making sure that you have good skin mobility and that you have good hip and low back and spine mobility and that you've addressed the C-section stuff, not only physically, but mentally as well. I think that's the biggest difference between the two births. And then in postpartum, recovering from a vaginal birth is very different than recovering from a C-section birth. They are two totally different birth methods that require different rehab protocols.
For you, which was harder to recover from?
Oof, that's such a good question. I feel like mentally and emotionally, the C-section was harder for a longer period of time. I was in a haze and like likely like a very undiagnosed depression, anxiety for probably the first 6 to 9 months that went undiagnosed. But I just like could not get out of this funk that I was in.
Yeah.
And I also feel like the first like 2 or 3 weeks was harder for a C-section for like my whole body, just like functioning. But then I feel like for the VBAC, like the first 5 days were probably harder since I did still have a second degree tear. The first like 4 or 5 days were like, whoa, this is way different than my C-section. But like mental and emotional clarity, I was right there. I was in it. I was alert. I was so much happier. And I think that's actually when I realized my VBAC journey, my VBAC postpartum, I was in such a different mental state that in that moment, I was like, holy smokes. I think that's when I realized like I was totally in a different mental and emotional state after my C-section because I experienced what feeling like supported was like and not going through all of the haze of C-section.
Yeah. Do you think part of the potential like mental fog or like the inability to get out of the funk was because of the expectation, the birthing expectation that you were holding on yourself for that first pregnancy and like wanting to do the at-home birth and then it turned into something completely different?
Yeah, exactly. I think I really was like in this spiral, if you will, of there was like shame and frustration and there was anger. And I also felt really unsupported during that time too. And I think that not only, but just in general, like I felt unsupported. and I didn't know what I was doing. And then on top of that, we had like breastfeeding struggles and tongue ties
Mm,
to deal with. And there was just, not only was I struggling, but also my baby was also struggling on top
and
of
that's
that.
so
And
hard.
such a terrible sleeper. And so like I just couldn't ever like catch up. But
Mhm,
it really was like the expectations that I had on my birth experience and
mhm,
it literally going completely opposite.
mhm.
And now I don't feel that way because I feel like I kind of turned my pain into, my purpose. But
Yeah.
it really took me, I would say, 2 years to really fully accept and honor my birth experience for that first one. It was not easy, but it took me a long time to process. And so I always tell moms that too. Like, if you have had a C-section that, or like a traumatic birth experience in general that didn't go the way that you planned, like, give yourself time to just really sit with all of those emotions and
Mhm,
continue to allow yourself to process it. And eventually, there should be some sort of healing from that.
mhm. And I feel like, to put things into perspective, moms that are listening, it's like when you get pregnant, majority of the time, even if you say, like, I only want a healthy baby, right? There's always like that 1%, like, I kind of wanted a girl or I kind of wanted a boy. And when you find out the gender of your baby, it doesn't matter anymore. A healthy baby is all that matters, right? And I think that if we took kind of that mindset into our birthing experience of, yes, I had this little, like, and of course more than 1%, but I had this plan of what was supposed to happen. But at the end of the day, the end result is healthy baby, healthy mom. Right?
Hmm.
Like, did we make it through the experience? Are we alive? Am I able to care for my baby? Even though for a little while it is painful and it's a very huge adjustment and your body is healing. I think we hold so much pressure on ourselves. And I'm very curious, like, if you went back and had that exact same experience, right? And if you didn't hold all that expectation or like this specific birthing plan over your own head, like, your journey, right? For your own health, like what that would have looked like. Would it have, been lessened, like that amount of depression that we're sitting in? And we can be our own worst enemy sometimes because we are just that hard on ourselves.
Hmm. Yeah. Yeah. I really do think it would have been different for me for sure. I think that I went into the birth experience for my first one feeling like almost like I had something to prove. Like I was
Right.
going to do this birth in the way that I wanted and it was going to go. And you're like, oh, first mom syndrome, first time mom syndrome, right? Like you
Yeah.
know that for your second birth experience, that's not going to happen. But really, if we, if any first time moms are like wanting to become pregnant and just really allow yourself to just surrender through that process and yes, have a birth plan. That doesn't mean that you can't advocate for
Yeah.
yourself. It doesn't mean you shouldn't educate yourself. It doesn't mean that you shouldn't be able to choose the birth experience and the providers that you want. It just means that you also loosely hold it happening in a very specific, exact way. And to your
Hmm.
point, like healthy baby and healthy mom, because a healthy mom creates also an environment for a healthy baby. And
Yeah.
so I think a lot of the disservice we're doing for moms, especially first time moms, like this is a whole new paradigm from womanhood to motherhood. It's like,
Hmm.
what just happened? And how do I navigate this transition? And I think if there was more consistent check ins and consistent support for mothers, especially that first time around when we literally don't even know what's going on and milk is spilling and we're like,
Hmm.
what is happening? I think that it would also foster an environment where mom could also be more physically, emotionally, and mentally healthy. And that would also affect our baby's nervous system and their health as well.
Hmm.
And so it's such a dyad. And I think it's so important that like the focus is on both because we obviously want healthy mom and we want healthy baby, but that dyad together is like the
Hmm.
dream.
Hmm. It's interesting that, like, in America, most people or a lot of couples, a high percentage actually go to marriage counseling to like deem themselves ready to be married. And I actually think that it would be more beneficial and like if we had to go to marriage counseling to prep for a baby and even like part of the postpartum care, like how are we supporting each other through this. And I've said this on my podcast before, but I swear I'm going to beat it into you guys' heads because it's something I have to remind myself constantly. But your marriage is the most fragile the first 6 years of your child's life, and so that's a lot of pressure and stress, also just on your household. And so it's really hard when you're going through your own personal experience that may be like not, full blown depression, but sometimes like days of depression, right? Or different things, hormonal changes, something to remind yourself and recognize. And I just think there's so much more that we could be doing,
Yeah. Yeah,
for
no, like
women.
there's that parent boot camp.
I know, right?
Education for dads too. Like dads should be just as involved as in birth education and labor education and how to support the mom postpartum. I think there's even studies that show like if the mom had good spousal support
Mm-hmm.
and the spouse was able to make sure that they're fed and have water filled. Like it's just basic things that
Yes.
our partners are very capable of doing. They just don't know how to do it because this experience
Mm-hmm.
also is new for them. So yeah, there needs to be like a dad boot
Yeah.
camp as well.
Even just stats, like the amount of water that we need to like rehydrate after breastfeeding a baby, like it's incredible. Like make sure the water is filled. That's it.
Yeah,
You know,
and change the
okay.
diapers
I
too.
swear we could talk forever. I do have one thing that I want to back up. In the beginning of this conversation, you mentioned the lack of pelvic floor care or referral postpartum, right? Like if you have not given birth in a hospital before, you are woken up, I'd say probably every 2 to 3 hours with a new specialist. This could be a lactation consultant, someone to, they're testing the baby for something. It is an entire gambit of things that they run down this list. And Jessica, do you know how far or are we there with them like adding a pelvic floor doctor into that mix?
We are still very much not there. I do think and I've had some great conversations with PTs, pelvic floor PTs that are like starting these pilot programs. Just even last week, I had a great conversation with a PT in my DMs, how she's starting a pilot program at the hospital so that moms can get support. So I
Mm-hmm.
think that we're like very, very much in the early stages, but it is literally PTs or OTs that are pioneering
Mm-hmm.
these like pilot programs for postpartum support so that at least moms before they discharge, at least they have some sort of guidance, encouragement, a sheet of exercises,
Yeah.
something, right? Or
A
especially
referral. I mean, I only
yes,
know because I happened to go to a birthday party while I was pregnant and a pelvic floor doctor this sat right next to me and I was like, "What do you do?" Right? And I'm like, "Wait a minute, I actually need to come see you."
yes.
Like that should not like that was just by chance.
Exactly. Yeah, everyone should go home with education knowing who do I call when should I call them and what are the signs and symptoms that I'm looking for? Just like they give you the signs and symptoms of like the baby blues before you leave, it's
Mm-hmm.
like what are the signs and symptoms of physical dysfunction that I also need to be looking at and what's an appropriate timeline for me to start addressing these? I think that, most people think you have to wait until 6 weeks and then you need to go to pelvic floor PT. And if you are going to go in person, you do choose to do an internal exam, that would obviously make sense to just try to eliminate as much risk for infection as possible. But that doesn't mean that you shouldn't or can't be doing some things like gently in your bed with our clients when we work with them. The best
Mm-hmm.
time to start, even if you don't work with us and you go somewhere locally, start in pregnancy. Just
Yes.
establish a relationship with someone. Even if you just go one time, you can
Mm-hmm.
also work on what's called birth prep or push prep, where we're teaching you
Yes.
different
Uh,
breathing techniques
do
and
you guys
pushing
do that?
techniques. Yeah. Oh, yeah, definitely. I would say
This
about 30
is
or 40% of our clients start in pregnancy.
Yes. So if you are pregnant right now, I am telling you, I am gifting this to my best friend when she gets pregnant. My pelvic floor doctor taught me how to push. She taught my spouse the things to do to help me remain comfortable. She took videos of us in every single exercise so that we could go back and look at these videos. We didn't have to remember while we were in labor. It is like start as soon as possible because when I tell you, I could hear her voice inside of my head, like explaining to me how to push when I was doing it. And I got that baby out in 30 minutes. Not saying that that was all because of her, but it is just the knowledge of like what the hell is happening to my body.
Yeah, I love her. That's absolutely amazing. And that's available for anyone. Like anyone can start in pregnancy. You don't even have to be dealing with some sort of an issue like leakage or prolapse or pain.
Mm-hmm.
Of course, if you are dealing with those in pregnancy, go then. But
Yeah.
even if you're not, like start around that 32, 33-week mark to start more for birth prep and push prep. And then you at least have that contact and that referral already in your back
Mm-hmm.
pocket. So you're not in the storms of sleep deprivation and all of the
Mm-hmm.
things that are going on and trying to do research at that time, you already
Yes.
have an established relationship with someone to just move right in. And even if you see them
Mm-hmm.
in pregnancy, they can also prep you for early acute rehab, is what we call that term.
Yes.
From 0 to 6 weeks, where literally no one checks in with you, especially your physical body. Like, what are some things? That's a great question. If you're going to see someone, is what are some things that I can do those first 6 weeks after I have my baby before I come back to you?
Yeah.
And you can go back to them sooner than 6 weeks, but it's just good to have, like, what can I do at home those first
Mm-hmm.
6 weeks?
I agree, especially because you will put yourself last as soon as that baby gets there. And this, like we said, can turn into a 10-year leakage problem. And it doesn't have to. Okay, I swear we could talk all day, right? We need to move into rapid fire because we're already past an hour. This is wild. But let's move in to our rapid fire. This fireside chat is sponsored by House of Noah. You can use code Macie Mincey for 10% off your entire purchase. But for now, let's heat things up. So, Jessica, are you ready for our quick
And
rapid fire round?
let's do it.
Okay. What's one early sign of pelvic floor dysfunction that most moms overlook?
Bladder urgency, feeling like you have to go to the bathroom and having to rush there if you don't have time and space to be able to hold it, and feeling like you're not going to pee your pants going to the bathroom. That's one that people overlook a lot.
Got it. Okay. What's the movement or habit you recommend avoiding in the first 4 months after pregnancy or after giving birth?
Ooh, this is such a great question. I'm like, yeah, we already talked about it earlier. I'm like, I mean, anything with like a heavy load if you have not rehabbed your pelvic floor and core first. So, like, going straight to do the half marathon without training for it, going straight back into CrossFit without rehabbing your pelvic floor and core first.
Got it. Got it. Okay. This one we probably already answered as well, but in case they missed it, when's the best time to start pelvic floor care? During pregnancy, postpartum, or beyond?
During pregnancy.
Got it. What's the most common myth you hear about pelvic floor after C-section?
Ooh, that the pelvic floor is spared. That a lot of people think if you had a C-section, my pelvic floor is going to be fine. But we have a lot of people that experience pain with intimacy, pelvic pain, tailbone pain after a C-section, and even leakage too, especially if they're dealing with more of a hypertonic pelvic floor.
Is that because of the weight of the baby that was like your pelvic floor was supporting this entire time?
I think it is more due to the hypertonicity of the pelvic floor. So a
Got
lot
it.
of people think, oh, I'm not going to pee my pants. I didn't have a vaginal birth. But you can still pee your pants if your pelvic floor is super tight and tense and just putting a lot
Mm,
of pressure on the bladder and not really giving a whole lot of space for give. And then pain makes sense, right? In the research, a higher incidence with pain after C-section is more common and normal, likely due to the incision. It was a major abdominal surgery. There wasn't any scar tissue work that was done either. So that can cause issues like in the neighboring areas as well.
okay. Got it. Got it. What's one small win new moms can celebrate within 3 weeks of being postpartum?
Just if you focus on breathing and like reconnecting to your pelvic floor and giving yourself like 5-10 minutes to sit in the pause and just honor your body for the incredible life transformation it just went through. You just grew a human and you birthed a human, and now you're likely feeding a human. So the fact that you did all of that in just 3 weeks, just pause, give yourself grace.
I love it. Last one. What's your recommended toy or tool on the market right now to improve pelvic floor strength?
Anything with vibration. Vibration is really good and healthy for the pelvic floor to experience externally or internally.
Oh, I love it. Dr. Jessica London, it was amazing having you. Can you please tell all of our guests where they can find you?
Yes, absolutely. We are mostly over on Instagram at your postpartum PT, but don't get it twisted. We definitely support people in pregnancy as well. And if you feel free, you can check out the link in bio. That's mostly where you can find us over on IG.
Well, I appreciate you. And I think that we got so much out of this episode. So thank you again for coming on.
Absolutely.
We know you're juggling a million things: kids, work, life, the entire world. But if you could take just a second to rate and review OnlyMoms, we'd really love you forever. Well, we already do, but you know what I mean. Your reviews help other awesome moms like you find us, join in the conversation, and become part of this amazing community. So if you've laughed, cried, or even just enjoyed hanging out with me, go ahead and drop us some stars and a few words. Plus, who knows? Your review might just get a shout out in our newsletter. So what are you waiting for? Tap those stars, type a quick note, and let's keep this mom tribe growing. Thanks, guys.